Hi, I'm Scott Miller. Welcome to my Top Performance blog. I am so pleased to be able to announce that as of today, feedback-informed treatment has been approved by SAMSHA, the federal government's Substance Abuse and Mental Health Services Administration, as an evidence-based practice. You can now see the summary of this approach on the official National Registry website, which is listed right here. The process was arduous and thorough, to say the least. Starting back in the summer of 2010, the team submitted the research studies that would be used in support of the application for FIT being deemed an evidence-based practice. About a year later, the team submitted over 1,000 pages worth of documentation to support the readiness for dissemination component of the application. First, we had to demonstrate that FIT had evidentiary support, but even more importantly, we had to show that the ICCE and the members were able to support people who wanted to implement feedback-informed treatment in their daily work. In support of that application, the team created 5 different treatment manuals, short 35 pages, bullet-pointed summaries of what it takes to be feedback-informed in clinical work. Manual 1 is a primer. What works in treatment? Manual 2 was a basic introduction to the principles and practices of feedback-informed work. Manual 3 covered how to do feedback-informed supervision, using the data to inform and guide and improve treatment practice. Manual 4, one of my personal favorites, was about how to document change. So once you get all this data, what do you do with it? How do you prove that your work is in fact effective? And secondly, how do you use that same data to improve your clinical practice? Manual 5 was applying these ideas with special service populations. And Manual 6 talks about implementing feedback-informed treatment in a variety of healthcare systems. The team at ICCE, made up of a variety of senior associates, also created a gap assessment tool called the FRIFM. You can get that tool for free on my website at scottdmiller.com. The FRIFM allows you, as an administrator or manager of a healthcare agency or setting, to evaluate just what needs to be done in order to successfully implement feedback-informed practice. They also created a service delivery agreement, also known as a treatment plan, and a service progress note that can be completed together, that is concurrently, with clients when FIT is in effect. None of this would have been possible without the support, encouragement, and dedication of ICCE senior associates and members. People like Suzanne Bargman, Jason Seidel, Rob Axon, Cynthia Malshak, Bob Bertolino, Bill Robinson, Robbie Babbins-Wagner, Julie Tilson, and the list goes on and on. If you've not already implemented, or even if you have started, the International Center for Clinical Excellence provides the largest web-based community of professionals using FIT in their clinical practice. You can join for free at www.centerforclinicalexcellence.com. I sure hope you'll also join us for one of our evidence-based trainings in FIT practice. Our next one is coming up in the 3rd week of March. You can register online. There are just a few spots left. The registration URL, again, right here on your screen. Later this summer, together with Cynthia Malshak, I'll be conducting the first feedback-informed treatment supervision intensive. Take a look on the website for information about that particular event, and know this, it's already half full, and we're only at the beginning of February. So if you're interested, register straight away. Okay, that's it for now. Thanks for listening. As always, if I can be of any help or support in your efforts with implementing feedback-informed treatment, feel free to drop me a line at info@scottdmiller.com.